tissue. That scar tissue can be as a result of an infection that has healed, or can be as a result of endometriosis, which is, or it can be the result of surgery. So whatever can cause an injury and then a healing that ends with a scar can lead to blockage of the fallopian tube when this happens at the fallopian tubes. And this is usually one of the factors that contributes to reducing fertility. So with that, we normally will recommend flavonoid complex because we are looking for supplements that is helping with wound healing as well as resolving the scar tissue. And that is flavonoid complex, chelated zinc, and of course, omega-3 salmon oil to resolve the inflammation that tends to also occur. So then about fibroids. And fibroids are also a fairly common problem. Fibroids are normally not cancerous growths, but they are growths that occur in the uterus. They can be linked to environmental toxins such as pesticides, food colorants, preservatives, artificial sweeteners, and so on. One thing on the lifestyle side, avoid storing and microwaving food in plastic containers, because some of the residues from the plastic can find its way in food which is being microwaved in a plastic container. So avoid that. And then fibroids also do not actually lead to infertility, but what they can do is sometimes cause problems in pregnancy depending on where they are situated. So for that reason, they can actually have a certain amount of effect on fertility. And so we recommend here again, Cruciferous Plus is going to be useful for fibroids. Remember, Cruciferous Plus is very helpful to help the body get rid of unwanted growths. We saw that in enlarged prostate, so we see it also here in fibroids. We also recommend Herbal Feminine Complex and Beta-Guard to help with detoxing, as well as multimineral alfalfa if the fibroids lead to excessive bleeding or heavy bleeding for the person. So Cruciferous Plus, Herbal Feminine Complex, Beta-Guard, and multimineral alfalfa to replenish minerals if there is heavy bleeding. Then I had a question about an infant with supplements for an infant with sickle cell anemia. And as we may have be aware, or maybe not, sickle cell anemia is a genetic kind of anemia. It's not the normal anemia that we come across where there is a shortage of iron or red blood cells. It's actually one where the body destroys its own red blood cells. And this is a genetic condition, as I mentioned. In the lifestyle side, we recommend plenty of fluids in the child's life. They drink plenty of water and other fluids. And also it is important to work with a doctor because the condition is always very painful, and there is a need for pain management as well as managing crises that occur from time to time. So it's good to have either a general practitioner or a pediatrician who is working with the child and the family just to help when there is a need, such as in a crisis or a painful episode. Then we recommend Liquivites because we are dealing with an infant here, as well as Neolife Shake. Those are the supplements that can be taken by infants. Later on, we may add omega-3, but because it is an infant, maybe the omega-3 would have to be opened and added to the food that the baby is taking to increase the omega-3. The omega-3 is quite helpful with the sickle cell because there is usually a lot of inflammation involved with the illness. So Liquivite and Neolife Shake. And as the child grows older, then we use things like Vital Squares, Vital Guard, omega-3 minis, and maybe also a bit of chelated zinc to help with healing after a crisis. The next question was about a person who had had a stroke a while ago and they are still suffering with weakness, muscular weakness from the stroke. And here we'll recommend lipotropic adjunct for blood health. We recommend omega-3 salmon oil, Neolife shake, and vitamin E to help the body to prevent future strokes recurring. So that is what we would recommend from the Neolife side: lipotropic adjunct, omega-3 salmon oil, Neolife shake to give a protein boost to the person, and vitamin E to help prevent future strokes. Because once a person has a stroke, it increases the chances of having other strokes again. So in addition to that, to help with increasing strength, we can recommend rehabilitation by visiting a physiotherapist or a massage person who give a massage and helps them to work their muscles, because sometimes if the stroke left the person disabled, then there was the muscles, the body was not moving enough. And so they need to get back their strength by doing certain exercises to rehabilitate the different limbs. And this should be done by physiotherapists. Then a lovely question here about nutritional boost for an 80-year-old person who has got no specific health issues. Would we not like to be such a person at 80 to have no specific health issues, but to be conscious enough of the importance of supplementation to ask a question on how to boost their nutrition? So here we would recommend Formula 4. We would recommend Neolife Shake and possibly multimineral alfalfa to give them a good boost in the minerals. So for this 80-year-old, well done for being able to maintain good health to this ripe age. And we recommend Formula 4 Neolife Shake and multimineral alfalfa. Then I have a question about one or two people, I think it was more than two actually, asking about how to maintain or gain weight. The one was a person who was losing a lot of weight, and the other was someone who wanted to gain weight but was not able to do so. So on the lifestyle side, we'll ask them to choose healthy foods which are rich in calories, so high calorie foods such as nuts and maybe meat that has got a bit more fat than usual, and then healthy fats from things like avocados and coconuts and so on. We also recommend that they do some gentle exercise to help to improve appetite, because some people have a poor appetite, and some bit of activity can help them. Nothing excessively vigorous, maybe going for walks for 20 minutes and or so on to work up an appetite. We recommend that they have frequent meals, maybe 3 meals and 2 snacks daily. And the types of food that are we normally don't recommend for people who want to lose weight. So they'll be doing the opposite of what we normally recommend. For example, plenty of healthy carbohydrates in their diets would be recommended in this case. But the only cautionary I would have there is not to yield to the temptation of eating lots of junk food, because instead of gaining weight, what someone can gain is disease. So even though the person is not overweight or is struggling to gain weight, it is a good idea to still keep to healthy foods, maybe just try to increase the quantities. Then on the Neolife side, we recommend Tree and N first and foremost to help the cells be able to absorb nutrients and get rid of waste. So Tree and N, number one. Then we also recommend Neolife Shake, which will give them a protein boost, and they can mix it with whole milk or fruit puree. So blended fruit, and add to that Neolife Shake to give a rich fruits Neolife Shake that will give them a protein boost as well as a nice maybe snack there. Then we also recommend vitamin B complex, which will help with the energy boosts, will help with their appetites also. So vitamin B complex, 3NN, and Neolife Shake. And then, of course, on their diet, to try to eat regular 3 meals at least, and 2 snacks, so they don't spend long periods without eating. Then my last question that I will tackle for today is two people that were asking about inflamed tendons. One was in the elbow, the other was a knee. So we can have this inflammation of the tendons that is called tendinitis. It can occur as a result of certain sports activities. Let us say people who play a lot of golf, people who play tennis or soccer and so on, where there is a lot of repetitive movements. It can end in making the tendon inflamed in this joint, the joints which are being heavily used. And what we can recommend on the lifestyle side is to see a physiotherapist about corrective stretching so as to help the joints, and also exercises that is going to counteract the movements that are being repeated, like let us say the golf swing. What exercise helps to counteract the effects of that? And then on the Neolife side, we'll recommend omega-3 salmon oil to resolve the inflammation. We also recommend Calmag and full motion. So those are the three recommendations, as well as a visit to the physiotherapist to get advice on stretches and exercises that will help the joint in its recovery. Of course, because when certain kinds of sports lead to a joint going out of balance, and that can be actually what causes the tendons to be inflamed. So by getting these stretches and exercises, corrective exercises as they are called, you will help the joint to recover its balance. All right, so I think that we have tackled quite a bit of the questions, and I hope that I got to your question. As always, if I didn't, remember you can send a question by WhatsApp if you need an urgent answer. On the other hand, we of course will now resume our monthly Q&As, so you're welcome to send your questions. As for now, I want to thank you very much for having given me this time, and to apologize for some of the glitches we have had. We are having a few changes here and there that maybe we're going to be better able to resolve in the next sessions. But for now, let me hand you over to Pascal and wish you a very good end of the month of February. I hope that we're all geared to finish the month of February with a bang. Thank you very much, everyone.
Thank you, Betty, and thank you for your patience. We're just having a few changes in